Good evening. My name's Ra, and this is Majid, and our other team members. So today we're looking at the quality of health between hospital and home healthcare. So through assessing, sorry, I should be clicking or rolling. So through assessing the context of the acute to home healthcare, we came up with a bunch of different insights, which a few are shown here on the screen. So we started our design with a personal story. So Scott's story went over a 9-month period when he was diagnosed with stage 4 lymphoma. He was in and out of treatment whilst negotiating family and work responsibilities. During this time, the patient-clinician experience was far from perfect and caused more harm than good. So unfortunately, Scott's story is all too common, but from this experience, we focused on 3 main issues. So the first one is the lack of professional communication, the lack of information on situation and patient options, and 3, limited consideration of personal circumstances.
Thank you. Hi guys, my name's Majid. Out of this discussion and what we distilled our problem down to was how do we coordinate, fund and enable continued personalised quality of life from that transition for families and their carers and patients from the acute care setting back to home, because as we know it can be a hugely life-changing experience. These are some of the terms that we looked at, but because of brevity of time I'm going to move forward. And the idea is not necessarily something novel, not something hugely technologically advanced. It really is working within the confines of the financial restraints that we have within the health sector globally, but especially in Australia. How do we best utilise the services, the resources that we have at hand to provide that patient-centred care that we all talk about and strive to achieve, notwithstanding the fantastic work that our healthcare professionals do, but away from that acute care setting when families go back into their own everyday life. It's a very daunting experience. And so we came with the idea of having patient care advisors. Who are they? They are volunteers who offer their time from their own personal experiences and want to give something back to people who are also undergoing and experiencing the same problems that they've had and they've managed to traverse. They could be staff members who have that time to want to give back even further. And we also have, some of you may or may not be familiar with the concept of nurse navigators. And also representatives from big bodies such as Cancer Council, the Heart Foundation, Diabetes Australia, etc. And where would they be based? They would be based right at the heart of that acute care setting within the hospital facilities. Upon patients being discharged, they would be there to provide that advice and that guidance, an empathic voice, to take the patients through that next stage so they don't feel left out in the open, having to try and find and traverse this maze of information and guidance that can be very, very daunting and concerning. They would be based there within the discharge periods of time, Monday to Friday, and resourcing would not necessarily be financially heavy. An iPad sitting in an environment which is neutral, not necessarily in a clinical room, but outside in garden spaces that we have within our hospital facilities, but also providing private spaces where needed. The Alan's journey, as Ra said, is not unique. And our carers and our personal care advisors will be there to meet and greet, that empathic, friendly voice, to understand and translate the advice, translate issues that the families are facing, specific to them, and into advice they would need to be able to then move forward to adjust to whatever that new quality of life it may be. They would provide the support and guidance, directing again, using the resources that we have out there, not trying to recreate the wheel here, but utilising the resources out there and directing families, patients, their carers and their friends to the sources that are out there. Utilising technology platforms such as an app that would guide them, direct them to those specific resources. Our next step, really talking about scalability, this was mentioned earlier on in the previous panel. It's an important issue, and this is something that is quite easily scalable, starting off by discussing and negotiating with our key stakeholders, peak bodies, our health services, our HHSs and our primary health networks, recruiting volunteers, working and creating that governance framework to provide the service. So thank you very much.
Of course, yeah. A great idea, obviously, really embodying the patient at the heart of everything that goes on with their care, which is what we're all here to do in healthcare, to be here for the care of the patients and for the individuals. And I think using or encouraging volunteers to be part of this, probably from their own experiences, so similar to myself, giving up their own time freely to help for other people going through something similar is crucial to the success of this particular project. And like I said, it's more of a comment than a question, but it's just something that we should do across the world.
Wow, we've gone from good ideas to do it across the world.
So we're all about-
Yeah, absolutely.
Well done, thank you team.